Hi, my name is Madison Cowles, and I am presenting on Clostridium difficile colitis. Clostridium difficile colitis is also known as C. diff or CDI, and it is a gram-positive spore-forming bacteria that is grown in anaerobic conditions, and this is most common diagnosed of infectious diarrhea in hospital patients today. C. diff can lead to pseudomembranous colitis, which is the inflammation of the colon due to overgrowth of C. diff bacteria. The history behind C. diff is that it was first seen in a stool of a 10-year-old boy in 1935 by Ivan C. Hall and Elizabeth O'Toole. However, it wasn't recognized to be an infection to a human disease until 1978 by John Bartlett, and he recognized that the toxins produced was the main cause of antibiotic-associated pseudomembranous colitis. In 1980s, a new strain was recognized, and that is strain NAP1. And NAP1, it has resistance to fluoroquinolones, and that is an antibiotic that is used in many hospitals to treat infections. Because of this new strain, there were many outbreaks, such as the outbreak in Quebec around 2000s. There was about 7,000 cases and 1,300 people died because of NAP1 strain. As you can see in this chart, that around 2000s, there was an increase of incidences in every age category because of the NAP1 strain. The C. diff is most found in high-income countries because they have a high economy to provide for good health care, which allows them to provide for antibiotics that are related to C. diff. And there are more than 3 million cases of C. diff per year in the U.S. And as you can see right here, we are more susceptible to C. diff than anybody else because of the high income. C. diff is transmitted by person to person through the fecal-oral route and is mostly transmitted within healthcare facilities. Transmission happens when you touch a surface or an object that is contaminated with C. diff spores, and it then enters into the mucous membrane. People that are 65 years or older, healthcare facility workers, and or patients, or those who take antibiotics, are more likely to get C. diff. The pathogen enters through the mucous membrane, and the spores pass through the digestive tract into the intestines, and germination occurs in the intestines. The normal flora is then wiped out, leaving just the C. diff, and the normal flora helps with is the competing bacteria that prevents proliferation of C. diff. However, if that is wiped out, then C. diff will proliferate into the colon, and two toxins are released, and those toxins are toxin A and toxin B. These toxins disrupt protein synthesis and produce the symptoms that are related to C. diff. Toxin A produces inflammatory responses and release neutrophils and mast cells, which are then attracted to the source of infection. However, toxin B is the primary virulence factor because it causes damage to the epithelial cells of the colon and then leads to pseudomembranous colitis. Their symptoms could range because of the severity of the infection. From some people could be asymptomatic or have mild cramping, diarrhea, or they could go into kidney failure, sepsis, or death. How is it diagnosed is that there are tests done, and one of the tests are enzyme immunoassays, which is the most common test, and it tests for glutamate dehydrogenase antigen or toxin A and B. EIA is the most rapid and cheap, but there can be a false negative. Polymerase chain reaction test tests for toxin B, and it is highly accurate and it could test for toxin B in asymptomatic people as well. The cytotoxicity test is used in lab settings, so it is less widely available, and this test is basically used for confirmation after the EIA and the PCR tests have been done, and the cytotoxicity test takes 24 to 48 hours. Right here is the PCR test, and then this is the EIA test. There is treatment for CDI, however, it is hard to treat because there is a really high rate of recurrence. After getting it once, there is about a 1 in 5 chance you would get it again. One way of treating it is antimicrobial therapy, and that involves metronidazole, vancomycin, or vidoxamycin. And the metronidazole is the first drug that was used and recommended to treat C. diff. However, as time went on, more severe cases started happening, and this drug wasn't effective to those severe cases. So vancomycin, and vidoxamycin were the other 2 drugs that were FDA approved to treat for C. diff, and it involves high doses every 6 or so hours. Another treatment is the fecal microbiota transplant, and it can help with prevention, or you get it whenever there's multiple recurrences. This is when healthy fecal bacteria is transferred from a healthy person to one with C. diff, and it restores the normal flora into the intestines directly through the rectal enema or colonoscopy, or from a capsule. Right here is the capsule, and then this is the rectal enema, and then the colonoscopy. Some people may have probiotics, however, it's not as effective, so it doesn't happen very often. Probiotics just basically replace harmful microbes. If C. diff continues to reoccur after the first one multiple times, then some people may have to undergo surgery. There is no vaccine for C. diff, however, you could prevent it by washing hands with soap and water. The spores are resistant to heat, acid, and antibiotics, so the alcohol, such as sanitizers or alcohol substances, do not kill the spores, so chlorine bleach is used to clean and disinfect. Avoid taking unnecessary antibiotics that can cause CDI, such as penicillins, cephalosporins, or fluoroquinolones. And then in healthcare settings, gloves and isolation gowns are used. When I was volunteering at a hospital, I saw this machine, and it's a machine that can disinfect a room after a C. diff patient has been isolated and treated. And it's a Trudy machine that uses UVC light to deconstruct the DNA of deadly pathogens. So if a C. diff patient comes and then is treated and isolated after they leave, this machine disinfects the whole room and kills all the spores. The CDC are trying to decrease incidences and promote protocols for infection control. As you can see, it continues to increase, and now it's about to stable out, and they want it to continue to be stable or decrease because of the protocols they are getting out there to healthcare facilities. So the CDC are getting together with the facilities to find barriers to prevent C. diff. They are taking steps in improving antibiotic stewardship programs, and the CDC uses the National Healthcare Safety Network to track the infection surveillance to see if there's any more new strains or incidences to where it would increase or decrease the deaths and incidences. and these are my sources. Thank you.